Hi, everyone. I am Linda Welbrock, the founder of Leading Women Entrepreneurs and the Force for Change Awards here in New Jersey. And we have such a dynamic, incredible honoree with us today, Cathleen Bennett, who is the president and CEO of the New Jersey Hospital Association. Welcome, Kathy, and congratulations on all of your work. I mean, what you have seen over the last year and a half, most have not. So thank you for everything that you've done.
Thanks so much, Linda, and I appreciate you all recognizing me and frankly the whole team behind me with this award.
Absolutely. So let's start. What is the mission of the New Jersey Hospital Association and what services do you provide?
The mission of the New Jersey Hospital Association is to improve the health of the people of New Jersey. And we do that through a number of ways. We do it through patient safety and education materials. We do it through thought leadership. We work with providers to create better delivery systems so that we're providing care within the communities and making sure we reach all of our community. We do it also through thought leadership with things like publications, analyzing different trends and data, and highlighting where the greatest needs within our community lie.
Incredible. I know that the last year and a half, there's probably a very long list of challenges that you saw during this pandemic, but what were some of the biggest ones that you had to overcome?
You know, Linda, this is something where we had a novel virus that posed a global threat, and it just had ripple effects across the entire world. And what we saw is that this was not just a healthcare challenge. Every single person in New Jersey felt this within our homes, within our workplaces, within our communities. If you think about it, in 100 days from the time we learned about this virus, appearing in China, we saw the whole world shut down.
I mean, it's just moving to kind of rehash the situation, like you said, for everyone as a mom, as a business owner, as all of the things that we play, the various roles in our lives. It just hit everyone. So what are some of the innovations that you were able to see in the healthcare industry?
When I think about how the healthcare industry has evolved, we've seen it take a much bigger role in public health. And we saw that masking worked. It helped to prevent the transmission, together with other public health measures of the COVID pandemic. But we also saw that masking worked for things like lowering the flu activity we normally saw during the late fall and winter time. We saw that telehealth became the new normal. So while there's still problems, I think, where you need to see a doctor in person, the pandemic itself introduced a whole new urgency to what had been a gradual switchover to platforms like Zoom for remote patient visits. And then unequivocally, we saw that vaccines are powerful tools. And that's what helped to accelerate our reopening in New Jersey.
Yeah, as a person who's experienced now telehealth, like I said, as a mom and as a patient over the last year, I mean, I think that's one of the silver linings of, something that is so tragic and horrible. But again, as someone who's really passionate about innovation, I can see that there has been some developments that have made life a little bit more, easier and a little bit more efficient in that way. Let me ask one last question. In this challenging time, what are you most proud of in response to this pandemic for the New Jersey, healthcare community?
There's not just one thing. I could say if I were looking at it from an NJHA perspective, the NJHA team stood up a pandemic response, and we got right from the beginning the power of data to inform decision making and to inform statewide the state of New Jersey's response to the pandemic. So, by that token, what we did was we stood up a COVID-19 data portal, and it had in there things like PPE and bed capacity and staffing and anticipated staffing shortages, ventilators. All these things were huge, were huge data elements that helped us to better understand what was the capacity of our healthcare system to surge. And it's what allowed our healthcare leaders throughout the state to come together and create a response and a surge response that allowed all of our almost 8,300 COVID patients back in April of 2020 to have a bed to receive the care they needed. And it's also what led to the successful discharge home of over 90% of our COVID patients in New Jersey.
I mean, it's just incredible to think about. And for you, being a leader in the state of New Jersey and being at the forefront of this pandemic with, the NJHA and all of the hospitals that you serve, it's with, huge gratitude that we honor you and the NJHA, and we are so thankful for all of the work that all of you have done. And we can't wait to celebrate you on November 8th as a Force for Change honoree in our hospital category. So we can't, like I said, we look forward to seeing you then.
Thanks so much, Linda. And I've got to say, it will be with tremendous honor that I accept that type of an award, and just, once more, give a huge shout out to our healthcare community, not just for their readiness for this unprecedented health crisis and for their clinical expertise, but also, let's not forget, for their basic humanity, the compassion, the tireless commitment that they brought as they cared for the loved ones of so many of us here in New Jersey, and as they lived their caring mission.
Well said.